Every journey starts with choosing a path, then bravely taking that first step. But even an experienced traveler may have questions. At Providence Health and Services, we take those first steps sure-footed, committed to helping our community, confident in our leaders to make sound decisions that support our work on the Providence Path, a mission of compassionate service reflected in our programs.
This program is providing our community with compassionate care, providing them with services, with referrals that are so needed.
Two Providence community outreach programs that are core to our values of reaching the poor and comforting the vulnerable are the Faith Community Health Partnership and Latino Health Promoters. The Latino Health Promoters program is powerful and diverse, with a far-reaching positive impact on individuals and our community at large.
I think the most important part of the Latino Health Promoters program is the education and prevention component, because the health promoters are going to our community and teach them how to prevent diseases and keep our community healthy.
The church is actually in the low-income housing projects for Los Angeles, and many of them would not have the wherewithal to have a doctor's visit, go to the eye doctor, a dentist, or even have their cholesterol checked.
Our program has been exist for 20 years, and we are working very close with the schools. We have more than 12, 13 workshops that the health promoters are providing to the schools and bring information about health, about the resources that are available, and about the different ways that the parents can be better in our community.
Volunteers also aid in linking people with health insurances, screenings and tests, plus local resources.
In my community, they need it. They needed information. They say the participants say never been in workshop before, and now it's more learning.
It's definitely bettered my relationship with my children. It brought a very positive change to myself, and I hear the same with the parents as well.
The Latino Health Promoters Program is the only one of its kind serving the area. It collaborates with over 40 organizations, has trained over 70 people to serve as health promoters, and emphasizes the importance of patient advocacy.
Many of our patients are seen at public hospitals, and they're so inundated with so many patients that nurses or doctors don't have the time. So they come here and they said, okay, they told me this, they told me that, but I really don't know what they were saying. So that's when the role of an educator as an RN comes in, the advocacy, the resource person. I really learned that here.
The Faith Community Health Partnership Program is also centered on a patient-healthcare provider relationship based on trust and empathy.
The special skills that they can apply through receiving the Faith Community Nurse training is spiritual. I would say they grow more spiritually, and they're able to really connect the whole health, mind, body, and spirit.
Being in tune with the faith, in tune with the patient and their love and with the belief, it just comes together.
These specially trained nurses help promote health and wellness both physically and spiritually, creating significant economies for the healthcare system as a whole and benefiting each of our patients.
When you discharge a patient out into the community, you want to have a resource. So that patient, for example, that went in with a heart attack, Providence can tell them, go to Guardian Angel, go to the Our Lady of Hope. They'll continue to monitor your blood pressure, your glucose, your cholesterol. So it's greatly beneficial because now that patient is not going to go back to the hospital again with another heart attack or a stroke.
Other patient benefits Faith Community Nurses provide include low-cost or free health screenings, including blood pressure, cholesterol, and glucose, TB tests for health ministry volunteers, blood drives, and healthcare professional networking opportunities.
There is unbelievable amount of people that have no access to care, and we are bringing it to them.
To best serve those most in need, our community outreach programs are administered with compassion, balanced carefully with fiscal responsibility, looking for high-impact preventative care opportunities.
Unfortunately, the appetite and the food of the average Latino is not very healthy. And so much of the exercise classes, the cholesterol checking, the high blood pressure has helped a lot of them control their diabetes, their blood pressure, specifically to maintain their health, which they would not have had that advice otherwise.
And I think about all the ways that I get lost in my own medical care and my own medical needs. And one thing that the faith community nurse is actually, she helps through that process. She's able to guide the person. A lot of times we just have questions, simple questions. Nutrition seems just seems like something we all hear from our physicians, something that we should all be doing. But there's a process to that too, and you have to sit with that individual and really look at them and say, well, what do you like now? What kind of foods do you enjoy now? How can we get you to eat healthier?
It is very important for the nurses to come out in the community today to give out the flu shots. It is important to control. Such a simple thing as a vaccine could really prevent a major sickness to an individual.
And while we strive to do the greatest good for a growing population, it's the individual patients' stories that stay with us and touch our hearts.
I would not have that chance, opportunity to learn more about the things that sometimes we want to ask people. Now that we have Carmen here, we could ask her, and she knows a lot of things that we are afraid to ask other people, in the streets or even in our family,
The eating program and the exercise is very important. Exercise for the heart, for the bone, for the emotional. I come here twice a month, and I learn a lot, and I share everything with the friends, and it's just very nice for me.
Being a faith community nurse has been just a wonderful, wonderful experience. The American Nurses Association, in our book of standards, says that faith community nurse is the only nurse who intentionally cares for the soul.
And so this is a lovely partnership with the faith leader and the parish nurse to really engage together and talk about that parishioner, that congregant, and really see how can we help this person.
Everybody's there for one goal, and that is to bring the services to the needy, and at the same time bring the faith and the spiritual side of it. That's why motivated me to join Providence.
So coming out and serving them, being there for them, providing resources, providing screenings, providing education. Truthfully, we live the mission every day.
As Providence leaders, your commitment to these outreach programs is a treasured gift for our patients and our community. Thank you for walking with us, walking together as people of Providence.